Welcome to This Explainer. Today, we're diving into a truly fascinating, completely unseen sensory environment, the world right inside the womb. Before a baby ever sees a face, a toy, or a brightly colored room, they're already living inside a really active, very real world of sound. But what does that actually sound like, and how does it impact them? Well, let's figure it out. I want you to picture a soundscape that isn't crisp and clear like the open air we're used to. Instead, imagine it filtered, low, rhythmic. Think about the constant, steady thump of a heartbeat, the rhythmic swoosh of breathing, the muffled rise and fall of a familiar voice. It's this incredibly immersive, almost ASMR-like environment of continuous, gentle white noise and vibration. So this begs the core question driving our exploration today. Does what a pregnant person hears, says, sings, or plays actually shape their baby's early auditory world? Like, do they genuinely listen? The short answer is a resounding yes. But it turns out we have to look at the science pretty carefully to understand exactly how that works. Section 1. The fetal soundscape, a filtered world of vibration and rhythm. To really get what the baby hears, we first have to explore this unique physical space. It's actually wild how the human body works as a literal audio filter. High frequencies, they get heavily reduced and muffled by tissues and fluids. But low frequencies, they travel much more easily through those exact same barriers. Basically, the womb actively curates the soundscape, prioritizing deep, rhythmic, low-pitched sounds over sharp, high-pitched noises. And this brilliantly illustrates why the mother's voice is just so incredibly special. Unlike outside noises that only travel through the air, the pregnant person's voice reaches the fetus through the air and through the internal vibrations of the body itself. Because it's literally traveling through bone and tissue, it's highly consistent. It quickly becomes the absolute most familiar sound in the entire prenatal world. Section 2. What the science shows, tracking fetal hearing and memory. We've actually got decades of research backing this up. Back in 1994, researchers confirmed that a fetus's response to sound definitively develops and becomes measurable later in gestation. Then, some classic research in 2003 proved fetuses show real evidence of recognizing their mother's voice before birth. And even more amazing, a 2013 study showed that newborns already possess neural memory traces of repeated speech sounds they heard prenatally. That is just mind-blowing. I absolutely love this quote, because it captures the essence of the research perfectly. The developing brain is not waiting for birth to begin listening. The baby's nervous system is already actively detecting rhythm, pitch contour, and stress patterns. Now, to be clear, they aren't understanding adult language, but they are absolutely learning to recognize patterns and familiar sound contours. Section 3. Debunking the playlist myth, separating fact from internet fiction. Okay, so it's time to address the rampant misinformation out there. We've all seen the marketing, right? There is a massive gap between expectation and reality here. The expectation is that if you play Mozart or specific academic audio files, you're going to somehow hack your way into creating a genius baby. The reality is much quieter, but honestly much more meaningful. Repeated sound patterns simply support early auditory learning and, crucially, help establish a calm environment for the parent. It's about familiarity, for sure, not a developmental performance hack. So, the takeaway here is this. Prenatal sound stimulation is not proven to increase a child's intelligence. I was actually amazed to learn that a 2023 systematic review looked really closely at this. They found that while sound stimulation might influence early fetal learning, the evidence simply does not support those exaggerated long-term claims of a smarter baby. Section 4. Why louder is not better. The dangers of unnecessary intensity. Since the goal isn't academic acceleration, we really need to talk about avoiding intensity. Some products out there actively encourage placing headphones or speakers directly onto the pregnant belly. Please do not do this. This can create completely unnecessary and uncomfortable auditory intensity for the fetus. Remember, the womb already naturally transmits sound. Normal speaking, gentle singing, and low-volume music playing normally in the room, that is more than enough. There's a saying I want to highlight here that really hits the nail on the head. The calmest world is not the loudest one. The goal is a steady, gentle environment. Subjecting the baby to intense, direct, high-volume stimulation is not just unhelpful, it actually disrupts the safe, muffled sanctuary that the body naturally provides. Section 5. Safe prenatal sound routines. Simple cues of connection.
Before we even get into the how-to, I want you to internalize this. If prenatal sound becomes just another task on your to-do list or another way to worry about optimizing your pregnancy, it has completely missed the point. This should never be a stressful performance goal. Remember, the very first listener during pregnancy is always the pregnant person.
So, here is a highly effective, pressure-free way to approach it. Step 1, choose one small, consistent sound cue. Step 2, always keep it at a normal, comfortable room volume. Step 3, keep the routine brief. And step 4, which is the absolute most important rule, let it be relaxing and enjoyable for the parent first. If a soft sound helps the parent settle and breathe more slowly, well, that lowered tension positively impacts the fetal environment too. It's a win-win. So what does a sound cue actually look like in practice? Honestly, it's super simple. A soft spoken reading from a favorite book. A gentle, low-volume instrumental track while dimming the lights. Simple humming or quiet singing, or even listening to a short relaxation script to wind down in the evening. It is all about repetition and emotional tone, not vocal perfection. Ultimately, we're really just redefining what this practice is. We're moving away from the stressful idea of stimulation and fully embracing a prenatal relationship. This means using steady rhythms and peaceful environments as cues of connection and warmth. It transforms a few anxious minutes into a beautiful little ritual, helping a parent feel present with the baby well before birth. Quick pause for a really important boundary here. Sound routines can absolutely support comfort and relaxation, but sound therapy cannot monitor health. If a pregnant person experiences medical concerns, pain, distress, severe anxiety, or a decrease in fetal movement, sound is not the answer. Always seek professional medical care from a qualified healthcare provider. As we wrap up this explainer, I want to leave you reflecting on your own sensory environment. Whether you are expecting a child right now or not, the baby is hearing a world we actively help curate. So tell me, as you go about your day, which sound feels most comforting to your own nervous system? A familiar voice, a gentle piece of music, a steady heartbeat, or just profound silence? Take a moment to think about that. Thanks so much for joining me today, and keep learning.